As I said, we're watching this documentary with fresh eyes. How do you prevent a pandemic? Is it what Italy is doing in that they are closing down the country? Is that the way we could potentially face this in other parts of the world?
I mean, it sounds so shocking, doesn't it? It's such an unfamiliar thing to shut down whole cities.
Have you ever seen that?
Not in my lifetime, but they did it back in 1918 with that scary flu that killed so many millions of people. And
the Spanish flu?
The Spanish flu. China has done these kind of draconian measures, and now they were having thousands of cases a day, and now they're down to a very small number. So it shows that that can work. The question is, how do you balance people's freedom, economics, all of that? So those are really hard questions.
So an entire country shut down in Italy. The numbers out of China have gone down drastically.
Yes.
I'm going to ask a question that some people have been posing. Are we certain we're getting accurate numbers from China?
So there was an expert group that the World Health Organization took to China just as those numbers started to go down, and they said they believed them because they went to the hospitals and there just weren't as many sick people. So it shows that if you take really extreme measures, you can contain that virus.
So the extreme measures we're seeing in Italy, will we see those numbers go down then?
It could be. Now, the longer that things go on before you take those types of measures, or even less severe ones, the harder it is to contain something.
Back here to our behavior and how we've changed. Restaurants, would you say people should continue to eat out? I hate saying that because this is big business. People make their living, wait staffs, so many jobs economically impacted by this. How do we approach eating out?
So I think it's good to get information on your local context, and it depends where you are in the country. And leaders are starting to say, public health leaders, officials, that if you are older, which is a risk factor for, we're lucky with the
They're saying 80 and older or 70 and older?
Actually, not that old, 60 and older.
60 and older.
Yeah, that you just want to, I know, right? That's,
wait, so it's 60. I swear to you, this morning I heard a report that said 70. So
well,
are
it
we
depends.
certain?
So if you look at the numbers from China, as we just talked about, as you just talked about, the children are less affected. But as you go up in the decades, it gets progressively higher.
So 60 and older pre-existing condition.
Definitely, if you have lung issues, heart issues, you just need to think a little bit more about being in places where there are a lot of other people. Okay. And definitely hand hygiene, that was a great thing that we just learned.
What is the one thing you think we're not talking about or asking regarding this situation?
So the one thing that's really hitting me is that when we hear that younger people don't have such severe disease, if you're a young person, you might think my individual risk is low. So I'm going to go out even if I'm hearing that coronavirus is around. But that's the wrong attitude. We need to think about kind of like our interest in our whole communities. So we have to be safe, not only for ourselves, but also for the people around us. We don't want to take that virus home and infect somebody who's older.
So you can't just say, all right, I'm younger, I'm not in any of these categories, because you could be a carrier.
You could have mild illness, and definitely if you have any symptoms, if you've got a fever, cough, those are the main ones, stay at home.
Last question I have to ask you, because I, again, part of the media for 25 years of my career, and I know we can hype up something like crazy. Has this been hyped?
So I think a lot of information coming at people, and you see it, and it may feel like hype. I don't want people to panic, because there's stuff we can do. There are things we can do. We should take this seriously. All we have to do is look at places in the world or places in our country, like Seattle, where that virus has taken a hold. It's a stress on our health system. We don't want our hospitals to be full of patients with this, because they have to treat us, for all sorts of other things. So we should take it seriously. But there are steps we can take. And you can go to coronavirus.gov, and that's going to be the latest information from the CDC. And then check out your local area. Get on social media, follow those local health departments.
What we did, we looked at the cases in our area just to educate yourself and not become so overwhelmed by what you're seeing all day long on social media and other places.
That's right.
Thank you.
And there's things we can do. Don't touch your hands, your mouth, your eyes.
Avoid touching our face. Thank you, Dr. Fink.